Hey everyone, welcome back to my channel. I'm Dr. Sheth, and today we're going to be talking about tips that I have if you're thinking about starting a family. It's what I like to call preconception counseling, and it's for the women out there who are thinking about having a baby sometime in the future and just want to make sure that they're doing what they can to be as healthy as possible. So if you're interested in this video, please keep on watching. And please subscribe to my channel and hit the like button. Without further ado, let's get started. My first piece of advice is pretty basic, and it's to set up an appointment with your primary care doctor to get a wellness exam, a prevention exam, or just to talk to them about wanting to start a family. This is a good time for you to get up to date on your vaccines, go over your medication, do blood work if needed, get a pap smear done, and also talk to them about any lifestyle changes you should be making to be as healthy as possible. If you're using birth control, it's also a good time to ask them about when you should stop using that birth control and what it might look like for you to get pregnant after you stop. If you're on birth control, you should ask your doctor how quickly you can get pregnant after you stop using your birth control. This can actually vary depending on the type that you're using, and it is referring to your return to fertility. So if you're not sure about what it is for your birth control, then you should ask your doctor. My second piece of advice is to look at your day-to-day habits. What we know is that eating well, exercising, maintaining a good weight is really important for your pregnancy. Obesity can lead to gestational diabetes and other complications during pregnancy. So doing what you can to be at a healthy weight and getting as much good nutrition is really important. Now, if you're smoking or drinking alcohol, that's an easy piece of advice, and it would be to stop doing those things. Both of those substances are negatively associated with pregnancy and can lead to birth defects and affect your child after they're born. So if you are smoking or drinking alcohol in excess, I would do what you can to start quitting as soon as possible. And your doctor can definitely help you with that. Now, the third substance that most people maybe don't know about, and it's not that obvious, is to cut down on your caffeine intake. If you're someone who really needs caffeine to get through your day and drinks multiple cups of coffee and gets headaches if you don't drink coffee or have your caffeine intake, that can be an issue. So if you're thinking about getting pregnant, working with your doctors to sort of cut down on your caffeine use and discussing what is considered a normal, safe amount would be really important. And there's caffeine in teas, in coffee, and some other substances, so make sure you talk to them about what your total intake is and whether you need to be concerned about that. My next piece of advice is to start taking a prenatal vitamin. The vitamin that's most important in a prenatal vitamin is called folate. And folate is really important on a cellular level and is involved in DNA synthesis. Now, a pregnancy starts from one cell and it divides a million times over to help develop an embryo and a fetus and a baby. So folate is really important during pregnancy. Most Americans get folate through their diet, and it's enough, but if you're pregnant, you need more folate. So taking a prenatal vitamin will supplement that need. The reason I recommend starting to take a folate supplement now is that a lot of women don't find out that they're pregnant until 6 to 8 weeks into their pregnancy, and sometimes even later. And a lot of the development and the growth of an embryo happens during that period. So taking a folate supplement ahead of time and getting your body replenished and well supplied with folate even before you're pregnant will be really helpful to your pregnancy, and I think it's very important. Now, my last piece of advice is to take a look at your skincare routine. As someone who is a skincare fanatic, I have tried my different products from all the different brands at Sephora, and a lot of them have active ingredients that are not safe during pregnancy or that are not well studied during pregnancy. Especially if you have acne prone skin like me, you might be using retinols, salicylic acid, benzoyl peroxide, and all of those ingredients I would avoid during pregnancy. So take a look at your skincare routine, do some research, and start to adjust your regimen so that it's safe for pregnancy. And your doctor can help you with that, your facialist can help you with that, and there's a lot of information online that can also give you some advice on whether it's safe or not. So I hope you guys really enjoyed this video. If you liked what you saw, please hit the like button, and I will see you guys next time. Bye!